Hi, welcome to Dr. Lisa Sulsenti's podcast, and I'm Dr. Lisa. And today we are going to talk about bridging the gap between functional and conventional medicine. I am really excited about talking about this topic because it comes up with my patients all the time, how conventional medicine and functional medicine can work together better. And it's a topic I really care about, and I want to start with setting the tone. Really, this isn't an anti-doctor episode. It's not about bashing conventional medicine. I respect medical doctors deeply, and I refer to them often. And that's why I want to have this conversation. And if you're in the medical world, I want to talk about how I believe this collaboration is absolutely essential in helping patients achieve their health goals. But I also practice functional medicine, and sometimes when I see patients and they're working with a medical doctor and I send them back to their medical doctor for specific testing or collaborative care, there seems to be misunderstandings, and patients come back confused and discouraged. They're told certain tests aren't necessary, even when they're still struggling with symptoms. So this is really where I want to help you guys, because today I want to be able to empower you as a patient, explain why I do ask for certain tests, and also extend an olive branch to any medical doctor or medical professional listening, because my goal is collaboration. It's not confrontation. So why do both approaches matter? Conventional medicine and functional medicine, they're just not enemies. They actually work beautifully together, and the two lenses are looking at the same person. They just may be looking at things a little differently. Conventional medicine's incredibly awesome at diagnosing some diseases, managing medications, managing symptoms. They do medical care amazing and can save lives. And so if you're having a heart attack and you go to the ER doctor, if you need surgery, you're going to need the surgeon. So there's no questions about that. We're not challenging this in any way. Functional medicine focuses more on root causes and prevention. It's really looking at more of these chronic conditions that have just a big question mark on everybody. We ask questions like, why is this happening? What's going on in the gut? Are hormones imbalanced? Are nutrients low? Is inflammation driving the symptoms? What is the cause, the root cause of this quote disease, or illness or health condition? And so we're not doing different jobs. We're just kind of seeing things differently. We're going down different paths of the same job. The job is basically to help the patient do best, right? And I feel sometimes it's really done well together. If you've had cancer, I talk to patients all the time when I look at their history and they've had, let's say, breast cancer, or they've had colon cancer, or they've had thyroid cancer, or something like that. And I'll ask, so what do you think the root cause was? What did your doctor talk about? And then they're like, oh, I don't know. I mean, it's just gone. That was the goal, is to get rid of the cancer. And I challenge my patients. I try not to sugarcoat things. I don't try to scare them, but I'll just say, okay, but if there's something within you causing this, right, and it's still there, then the cancer has a chance of coming back, correct? So wouldn't it be great to try to find out what the root cause was? So that's what I see functional medicine doing, the job of functional medicine. And in practice, I often ask patients, go back to the primary care doctor and ask for labs or certain referrals. Sometimes I'll refer to a certain doctor because they need something deeper. And sometimes these requests are declined. And I want to explain these tests and why they matter. And if you're listening as a doctor, please consider this. A common example is thyroid testing. And many patients only get the TSH test, and the TSH is helpful, but it's only one piece of the puzzle. A full thyroid panel includes a free T3, a free T4, a TSH, a reverse T3, and thyroid antibodies. And I mean both of them, the TPO antibody and the TG antibody. And a lot of times these are left out. And I, again, have talked to medical doctors and they'll say they're insignificant, or there's nothing we can do about lowering them, or they'll just say insurance doesn't cover it. It's a bunch of, I don't know, I want to say garbage. I can't find the right word, but it's just a bunch of blah, 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 blah. Thyroid antibodies are especially important because the autoimmune thyroid conditions like Hashimoto's and Graves are extremely common, especially Hashimoto's. It's very, very common in the United States, and it can be missed if the antibodies aren't checked. I also frequently ask for vitamin and mineral testing, things like vitamin D, B12, iron, ferritin, magnesium. I like to look at things for MTHFR, how well is B6 doing, how well is B12 doing, how well is folate doing. If we can get a medical doctor to go a little further, we'll definitely look at homocysteine and we'll look at glutathione, because these nutrients are foundational for brain health, for hormones, for energy, for the immune function. And deficiencies can cause symptoms of the diseases. So here's the thing. If you're getting to the root cause of something, it could be a vitamin deficiency. A lot of times thyroid problems could be iodine deficiency. It could be magnesium deficiency. It could be B2, B3. It could be selenium. So you want to be able to really look. It could be glutathione being the issue in methylation and MTHFR. So there could be root causes to why the thyroid panel doesn't look good. But here's the thing I want to challenge you on is that with the thyroid, this happened to me. So I can say that this is absolutely true. This does exist, and you guys are missing it. And the problem I'm having, if I want a patient to get a full thyroid panel, they can go through me. Yes, I can order it. But a lot of my patients sometimes are working with a medical doctor, and they want to go back to their doctor and they want to say, hey, this is what I'm doing with a functional medicine practitioner. And the patient's being completely transparent, completely caring, completely proactive, is what we want. And they're really excited to tell the medical doctor, look what I'm doing. And then they get poo-pooed by, oh, you don't need that. Or they go and they order the thyroid panel. I have it written down, by the way. I have a piece of paper where I literally write a letter to the medical doctor. So there's no getting out of this. I say exactly, I want the TSH, I want the free T3, I want the free T4, I want the two antibodies, the TPO and the TG. And hey, if we can throw the reverse T3 in there, great. I literally write it out, and some of them tell the patient no, but some of them actually order the labs and we're missing the antibodies. So it's like the patient gets very, very discouraged, and they come to me, and yeah, they don't say some nice things about the medical doctor. You're starting to lose your patient because what you're doing is you're just not hearing them. They're spending money on functional. They're actually proactive. They're actually trying to get down to the root cause of the problem. They aren't excluding you. They're going back to you with my letter, and they're saying, hey, can you order this? Yeah, it gets covered under my insurance. Yes, you get paid. Yes, I pay you. Yes, I pay the insurance company. So I understand their frustration. There's no reason why you can't order a full thyroid panel. And if you're going to come up with an excuse right now, let me tell you, I had an underlying full-blown Hashimoto's 3-centimeter goiter growing in me for years. And as it was full blown, I was getting perfect TSHs, perfect T3s, and perfect T4s. So my doctor was telling me, you're fine. I felt horrible. I know I wasn't fine. So when you get perfect thyroid labs and the patient is telling you to their face they don't feel well, which is what leads them to my office, you've got to listen and you've got to do more. And you've got to work collaboratively with me. That's how I see it. We're looking at the patient. This is for the patient. This isn't an ego thing. This isn't I'm better than you. You're better than me. That's not what this is about. Because I do something differently and you do something differently. And that's not a bad thing. If we all did the same thing, we would all be in trouble. Because, right? Like I always say that. If we were all the same, it wouldn't be good. We'd be missing out on so many great things. So the thyroid is a really big area in the United States that gets completely screwed up. And so I am begging medical doctors, nurse practitioners, everybody, order the full panel. Stop doing this nonsense. You're missing full-blown Hashimoto's. And you might say, well, you don't really have Hashimoto's if the thyroid. Yes, you do. I was so sick. I had a 3-centimeter goiter, and the only way I diagnosed it and found out what the heck was going wrong with my body was me ordering my full panel, me ordering the ultrasound, and me diagnosing myself. And then, yes, I had to actually treat myself. So, let me tell you, these women can be coming into your practice and you're writing them off as, oh, they just had a baby, they're tired. You're writing them off as their perimenopause. You're writing them off as menopause, and they can have full-blown autoimmune thyroid, which, by the way, can be coming from leaky gut. It can be coming from a gut pathogen. It can be coming from parasites, mold, lots of toxins, lots of things. So that's when I see that. We diagnose that, we know what the problem is, but now we have to nutritionally support it because it could be coming from vitamin deficiencies. And then we need to go deeper. And that's where I work collaboratively. Let's get down to the root cause of what their thyroid problem is. Some patients have that MTHFR gene, which is a genetic mutation, and it interferes with how they process certain vitamins, especially folate and B vitamins, B12, B6. So a person could really have some diseases or some disorders or some dysfunction in the body, such as a thyroid problem, due to MTHFR. They also can have ADD, ADHD. They can have actually cardiac. You can have high cholesterol here, all because of high homocysteine. So a lot of the things driving maybe the cholesterol when they come in your office. Ask why. Why do they have high cholesterol? Cholesterol is just a buoy. It's just a buoy. It's saying, hey, something is out in the periphery. That's why we keep dumping more cholesterol out there. The liver keeps sending cholesterol out to the bloodstream because something's out there. There's inflammation out there. So ask why. Why is the cholesterol high? Why are there vitamin deficiencies? Why are there imbalances in the thyroid hormones? Why is the estrogen high? Here's another one. This is a huge one. I can't even begin here. You're taking women's breasts off. You're going insane with breast cancer, and some of it's rightfully so. I understand that, but you're never actually saying why. Why was the estrogen high? Why was the breast cancer all estrogen? Why does this woman have so much estrogen in her body? So there are times when I look for these, and I'm also stool testing for gut bacteria. I'm looking at autoimmune markers. I'm looking for parasites. I'm looking at the fasting blood work for glucose you send me. I'm looking for the fasting blood work for cholesterol and triglycerides. And by the way, that's another thing to collaborate with the medical doctors. A lot of you are bringing me lab works without fasting, and it's useless. It really is, because I'm looking at a whole meal that you just ate. I could tell when cholesterol is really high in glucose and triglycerides. I could tell that you ate. So please fast for glucose, cholesterol, triglycerides, so any of the cardiac markers and any of the diabetes markers. Please fast. It makes no sense. And so those are useless labs too, and it's very hard to collaborate when I send them back and then they tell me my doctor said this was fine, that I don't need that. I can't tell you how many... The reason why I'm doing this podcast is because and I know if you're my patient, you're shaking your head because you know what I'm talking about. So many of you medical people tell my patient no when I send them a nice little letter and I ask you to run, can you rerun the glucose, cholesterol, and triglyceride with a non-fasting, please? No. Why? Why not? Because it's useless numbers. From a functional perspective, these tests help us prevent diseases and address the root causes and not just diagnose a problem or treat a symptom. So that's the difference. So I'm extending an olive branch to you if you're a medical doctor listening or a nurse practitioner or anyone in the medical field that has this, collaboration with me. I want to acknowledge something really important. I know many physicians truly want to help their patients. I get that. I know why you're in it, and I know that you have a very hard profession. I also know you're working with a system that's incredibly constrained. And that's the sad part of your profession, is that you are controlled, you're constrained. Insurance companies often dictate what is considered medically necessary. So appointment times are short with you. You don't get to spend much time with the patients. Guidelines and liability concerns influence which tests you can recommend. Medical training historically focuses on diagnosing and treating diseases and symptoms and not really looking for root causes and prevention and optimization longevity long term. So I get that. So when a functional medicine practitioner requires additional testing, it can feel like I'm outside your protocol. I'm outside what you're really kind of allowed to do, or maybe what you're trained in, and I can understand that can be confusing. My intention is never to undermine your expertise. It's to collaborate for the patient's benefit. So when I send a patient back to you, it's for that patient. I'm not trying to undermine you in any way. I truly believe the future of healthcare is integrated healthcare, where the MDs, the chiropractors, the functional practitioners, the acupuncturists, the massage therapists, the nurse practitioners, and other specialists communicate and respect each other's roles. We're not in competition with one another. We are here to make the world a better place and get the patients better. That's how I see it. Okay, so now let's talk a little bit more to the patient, to you, instead of more to the medical doctor. If you are paying for your health care, you're paying your insurance premiums, you do have a voice, and you deserve to understand your health. You're paying. So if you were to hire somebody, right, to come in and clean your house, you're paying her or him. And you see that transaction, right? When you go to a store and you want to buy, a pocketbook, or you want to go buy, I don't know, you might want to go buy a coat, right? You're paying for it. So it's the same idea here. You're paying for your health care. So if your doctor declines a test, and you can respectfully ask questions, and here's some phrases you can say. You can say, I'm still having symptoms and would like a full thyroid panel. Is there a medical reason not to order this? And listen. If insurance won't cover this test, can I pay cash? Here's another thing I want you to understand from your doctor's perspective. They're constrained. So a lot of them, and I have friends that are medical doctors, and we could be on the beach or at a barbecue, and I ask these questions. So I know the answers. And I'll say, why don't you guys just order a thyroid panel? You're really missing so much. They're like, we can't. We have to do TSH and T3, and if they're off, then we can go further. That's sad if that's the case. But I want you guys to understand that there are medical doctors that I do collaborate that are amazing, and they do order that full thyroid panel, and it does get covered. So it does get done. It can get done. And I have many that I collaborate, because what my patients do is they fire the ones that won't, and they find the ones that will. So they have a great team. They've built a great team. A lot of the patients, by the time they get to me, have done that. But this podcast is definitely for the patients that are struggling with this. If you're going to pay in cash, of course, ask how much. But, I can tell you right now, it is easy to get the thyroid covered through insurance due to if they use the right diagnosis code. So when you order a lab, they have to actually diagnose you. They put in a little code, and it gets sent to the insurance company, and the insurance company decides if they're going to approve it or not. But it's going to be approved or disapproved based upon that code. Can you document in my chart that this test was declined? Okay, that's actually really important, because if it's declined and you want to do it again, you can challenge that. Is there a guideline? Is this a guideline issued? Is this a guideline issue? Is this a protocol issue? Or is this an insurance and restriction? Try to verify why they're saying no to you. Are they saying no because the insurance company is going to say no? You can call your insurance company, right? You can say, hey, I'm getting told that this is a no. Here's the symptoms that I have. I actually put the code on I put the code on my letter. So if you come to me and I think it's full-blown Hashimoto's, I write that down. I write fatigue. I write down chronic fatigue. I diagnose it, and I sent it back. So the code is a communication between me, the medical doctor, the insurance. You could also call the insurance company and say, why would this be declined? Is it something they're just not comfortable doing? Ask them why. They're people. They're humans. They live next door to us. They shop with us. They're not God. So just ask your medical doctor why. If you're not comfortable ordering this, can you refer to me somebody who will? What's wrong with that? You could still keep your medical. If you love your medical doctor and you're having a problem with this one thing, it doesn't mean you have to fire that medical doctor. You might just want to go to somebody else that's going to help you with the thyroid, and then go back to your medical doctor for other things. There's nothing wrong with that. He or she just might not be comfortable in this area of healthcare. And that's okay. These questions are polite, they're professional, they're empowering. You're not being difficult, you're being informed, right? You are being proactive. That's the most important thing you can get either side. If I'm talking to a medical professional right now, if I'm talking to a patient, proactive. We want patients that are proactive. The most frustrating patient is the patient that wants a magic wand and just wants to get better and wants me to do it or the doctor to do it. And I know if you're in the medical profession, you know what I'm talking about. Like, you can give them, solutions, and they just won't do them. I have, a few of those patients, and they're the ones that don't get the results that they want. They don't do the work. So when you have a proactive patient in front of you, or you're being proactive, that's an awesome thing. That's a good thing. It's an empowering thing. And I often tell my patients, you're the CEO of your health. You're the boss. Your doctors are consultants on your team. A good consultant welcomes questions. You can't beat that. So my version for healthcare is actually really simple. It's collaboration. So imagine a model, if you will, where your primary care doctor manages medications and diagnoses and symptoms. Your functional medicine practitioner addresses root causes. And we work with the imbalances in the body to prevent chronic illnesses. If you have a nutritionist, or sometimes the functional medicine doctor is a nutritionist like me, we'll support diet and vitamin deficiencies, and everyone shares the information. The patient is the center of the team, and the team is us. This isn't conventional versus functional medicine. It's integrated medicine. So I hope this is helpful. If you're ever felt dismissed or confused, and just you're not alone, the healthcare system in America is fractured. Don't be too hard on your medical doctor. I know that you just have conversations. They're human. Just talk to them. If you feel you can't talk to one, maybe that is when you would fire them and look for somebody else. But honestly, I think if you can just say, hey, I just need to talk. I need 5 minutes of your time, and ask questions. Bring a list of tests. Bring a list of questions. If sometimes you go in the freeze there when they walk in the room and you get a little nervous, no reason to be nervous. Again, they're human beings. They went to school. They lived in your neighborhood. It's all the same. They're the same. They might just be good at what they do, right? As I always said, I get people that get all freaked out by medical doctors, and I'm like, look, the person's just like you and me. They might be really good, at, let's say, surgery, right? They might be really good at this one thing, and that's awesome. But that doesn't mean that they know everything, that they're good at everything. It doesn't even mean they're a nice person, so it's like, it doesn't, that's not who they are. It's what they do. They might be really good at what they do. You don't know who they are. They could be a wonderful person and not be good at what they do. Who knows? But the point is, ask questions. Have a conversation. Don't be afraid. If you get nervous in there, have the questions written down before you go in. Advocate for yourself, or bring an advocate. If you're like, I don't know, I just get so nervous. It's just the way it is. I can't speak up to my doctor. I just can't. Bring somebody. And again, it's not a confrontation. It's a conversation. If you're a physician, listen, I invite collaboration. Our patients win when we work together, and that is the ultimate goal. So this is a podcast for all you guys. Thank you so much for listening. And if you found this episode helpful, please share it with somebody who needs to hear it. I'll see you in the next episode for sure. Take care.